Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, with the extension of phase 1 of the lockdown ease, the country records more cases of COVID-19. With the coronavirus putting severe strain on health systems of most countries, the search for a solution intensifies across the globe. U.S. President Donald Trump sends letter to the World Health Organization, threatens to pull funding permanently over COVID-19. The realities of the moment as a result of the global pandemic has thrown a great challenge to the Nigerian government and Nigerians. For the first time in years, the country is exposed to a situation where there is no quick intervention readily available. The race is on as to getting a solution, a vaccine. And in its quest, the World Health Organization says that 8 candidate vaccines are in clinical stages. About 100 candidate vaccines in preclinical stages are being developed in laboratories around the world. Madagascar has come out with its own homegrown solution, the COVID Organics. But as COVID-19 infections and deaths rise in Nigeria, what are the medical research efforts by the country's best? How far inward are we looking for solutions to the deadly virus? This afternoon, we analyzed the drive for a local solution. The confirmed cases of COVID-19 in Nigeria have now exceeded 6,000, with the announcement of 216 new cases last night by the Nigeria Center for Disease Control, NCDC. With the new infections in 14 states and the Federal Capital Territory, Nigeria now has a total of 6,175 cases. Out of that number, 1,644 patients have been discharged, and the country's death toll is now 191. Lagos has 74 of the new cases, Katsina 33, Oyo 19, Kano 17, Edo 13, Zamfara 10, Ogun, Gombe and Borno states have 8 each, 7 each in Bauchi and Kwara, 4 in the FCT, 3 each in Kaduna, Enugu, and 2 in Rivers State. A breakdown of the figures by region shows that Lagos in the southwest still has the highest number of cases, followed by Kano in the northwest with 842. In the north-central region, you have the Federal Capital Territory, the third highest tally with 422. Borno now tops in the northeast with 223 cases. Edo leads in the south-south with 108. We have Enugu in the southeast with 15 confirmed cases. In the meantime, the governor of Abia State is challenging those manning the state's borders to ensure total closure of all the entry points. This follows the confirmation of 5 new cases of COVID-19 in the state. Governor Okezie Ikpeazu, who briefed journalists in Aba, said 3 of the 5 new cases are returnees from Lagos, while the remaining 2 are residents.
5 new cases on our hands now. These 5 new cases, incidentally, 3 of them are returnees from Lagos, while the other 2 are asymptomatic and have no history of previous travel. The circumstance of these cases has brought to the fore the need for us to re-emphasize total closure of our borders and commitment by every person, especially those that we have assigned the duty of manning our borders.
Now, Plateau State inaugurated a research team made up of seasoned academicians in medicine and pharmacy to research into ways of evolving homegrown solutions to the coronavirus pandemic and other infectious diseases. Inaugurating the committee at the Government House in Jos, Governor Simon Lalong charged members of the committee to brainstorm and come up with practical alternatives to dependence on foreign solutions.
Here on the plateau, we are endowed with human and material resources that are capable of giving us the solutions we desire for the treatment of infectious diseases such as COVID-19 that we are dealing with today. It is for this reason that I decided to bring together this crop of professionals who have done so much in the field of medical and pharmaceutical research within and outside the state, to brainstorm and come up with practical alternatives to our dependence on foreign solutions. It is a known fact that Plateau State is endowed with herbal and medicinal products that could be harnessed towards building our capacity to withstand the threat of diseases such as the coronavirus if and when they spring up.
Over in Edo State, the government is putting more efforts into repositioning its healthcare facilities to deal with the threat of the COVID-19 pandemic. According to the chairman of the state's technical committee of the COVID-19 response team and Deputy Governor, Mr. Philip Shaibu, the present administration has laid grounds for an upgrade of health institutions in the state to tackle the virus. He made the comment after inspecting renovation at the Stella Obasanjo Hospital in Benin City, the Edo State capital.
We are upgrading and also putting our facilities in place for COVID-19 and post-COVID-19. It has become obvious that Edo will be the hub of medical tourism, the level that we are taking it now. And that is what informed the expansion and the renovation of this particular facility. You know what it used to look like. Going around today, we can see that there's serious upgrading and standard has been enhanced. And it's not just about the physical infrastructure, it's also about the equipment.
Well, let's now dissect the local solutions to COVID-19. And joining us in the studio here in Lagos is Dr. Adesina Adega, Director of Research and Innovation, Mountaintop University. Welcome to the program. And we also have joining us via Skype Professor Oyewale Tomori, a former virologist, Regional World Health Organization, Chairman, Expert Review Committee in COVID-19, and former Vice Chancellor, Redeemers University. Thank you so much for joining us on the program. All right. Let me quickly ask, let me begin by asking your boss first, your assessment of our efforts to reducing the spread of COVID-19. Would you say that we are making moderate progress?
Yeah, I like the word that you qualify the progress with moderate. Yes, moderate. Yes, we are. But not, what we need now is not moderate progress. It's rapid, quick, sustainable progress. That's what we need right now. Moderate progress is not getting us where we should be. Over.
Our theme is looking at solutions, finding local solutions to COVID-19. And some experts have said that we really need to look inward. If you remember, the Oyo State governor said that vitamin C, carrots, black seed oil mixed with honey boosted his immune system to indeed overcome the virus while in isolation. What do you make of that, and perhaps plans that state governors like the Plateau State governor and other state governors are making to indeed find a solution to COVID-19?
Thank you very much. Indeed, we should look inwards, the right thing to do. But when you're looking inwards, please put light into the inwards so that the dark corners are also seen. There are many, many pitfalls in what we're doing, and we need to properly turn our research on those points and prove the useful ones so that cure will not become a cost upon us. There are processes which are required for testing whatever comes out. We should follow due process and not just claim it because somebody has said it works for me. It must be proven and tested according to due process.
All right, Dr. Adega, let me come to you. You know, this is a race to finding a cure. Would you say that we're on the right track?
Well, as Paul said, it's more or less we are trying palliative treatment, palliative handling, and that has been saving. But then what Paul said as the eagerness to get the cure is primary. And then developing vaccine is also primary and very paramount because not everyone has the knowledge of getting all these palliatives. So, but when there's vaccine, or when the vaccine is developed and it's been tried, then it's going to be a tremendous milestone covered. So, because it's going to protect both the viable, both the susceptible and the unsusceptible.
So we're hearing about antibody tests as one of the solutions from the West. Is that something we should look into?
Antibody tests is not as easy as that. You know, I mentioned when I came here last time that if you are going to use antibody, it must from the people that has recovered, you must test that they are negative 14 days or even 2, 3, 4 weeks or a month after the most of so they must be tested. And one, that's two, they must be the same genotype of blood-wise with the people that are going to get the plasma. So it's very delicate, although it's very good, and it's just going to give an instant, not a permanent, because what is what called passive immunization, to give a quick rescue. But permanent one is getting the vaccine and then vaccinate as many as possible. And that's why vaccinating like a lot of people will save a lot because you're going to save both the vaccinated and the unvaccinated. Unvaccinated, what I mean by that is that people that are on suppressive drugs, like transplant, then people that are having HIV, you cannot vaccinate them and get results. But when many of them that have been vaccinated, get vaccinated like that, and they limit the transmission because, and that's what you call herd immunity. Community immunity is very, very vital in this. So once the vaccine is produced and let people be vaccinated, are going to get a better result than this.
Let's quickly ask Professor Tamori, and that is looking at the solutions. Some of the solutions, some people have said, is herd immunity, and then, of course, the anti-blood body test. What's your take on that, and what role do you think Nigeria should be playing to perhaps getting a grip with some of all of these other efforts around the world?
Thank you very much. Sorry, I missed part of what my friend said. But first of all, let me say that at this stage, what Nigeria needs is not antibody testing. At this stage is to know what is the volume, what is the magnitude of the problem we have. And that is only through antigen testing by PCR and other things. So that tells you how much is your problem. We'll get to the level of antibody and all those things later. But that day we need to know the magnitude. We need to be able to use the antigen testing to determine the focus of where our problems are and quickly go to those areas, trace the contacts, and commit and quickly put all those ones on there. Otherwise, we're going to have this thing spreading all over the country without all the issues. I'm not too sure what vaccines and things. But let me say one thing. For us in Nigeria at this stage, let me just say that we can participate in parts of other studies of vaccines. But if you are dreaming of making any vaccine in this country, let's forget that dream immediately and now. But there are other stages in the vaccine test, like clinical trials and even eventual production of the vaccines. We should there. The foundation, the basic research in the science of vaccine is not in this country. Let's not deceive ourselves. Over.
All right. Is it impossible, the dream, according to Prof? Just one sentence.
It's not impossible.
It's not impossible, so you disagree with your boss. Thank you. Thank you so much, Dr. Edison Adega, Director, Research Innovation, Mountaintop University. Thank you for joining us. And thank you as well, Professor Oyewale Tamori, a former virologist, Regional World Health Organization. Thank you for your time.
My pleasure.
All right, we still have more on the COVID-19 updates when we return. Welcome back. And Bauchi State Government has commenced distribution of palliatives to 2,000 households across 3 local government areas of the state where the total lockdown is in place. Each family is expected to get a food basket containing rice, maize, millet, beans, oil, salt, tomato, and many others. Chairman of the committee, who is also Emir of Bauchi, charged members to ensure they discharge their duties as expected of them. In the meantime, more donations are still to come to the state, the latest from former President Goodluck Jonathan, who donated 1,000 bags of rice and beans through his foundation. Here's our correspondent Hajara Aliu with more.
Last week, Bauchi State Government imposed total lockdown on 3 local government areas worst hit by the coronavirus pandemic. And just yesterday, Monday, the state government commenced distribution of palliatives to those affected local government areas of Katagum, Zaki, and Giade to lessen the impact of the lockdown on the people. 200,000 families are expected to benefit from these palliatives. Emir of Bauchi, who is also chairman of the palliative committee, has charged his members not to fall below expectation while discharging this important assignment.
And still, I want to call on about all the members that it's time for us to be proactive. And remember, whatever we are doing, fairness, integrity, and transparency is our watchword.
Donations to the state have not ceased, and the latest that have come in is from former President Goodluck Jonathan through his foundation. He has brought succor to the people through the donation of 500 bags of rice and 500 bags of beans to the state. From Bauchi State, Hajara Aliu, Channels Television.
Over in Zamfara, the state government flagged off the distribution of relief materials to vulnerable households and poor citizens and those affected by banditry across the state, part of measures to cushion the effect of the lockdown against the spread of COVID-19 on the people. Speaking at the distribution of the relief materials, the state governor, Mr. Bello Matawale, who was represented by his wife Aisha, says the gesture is significant because it is coming at the holy month of Ramadan, when Muslims are observing their 30-day fasting, adding that the food items and other palliatives will bring succor to each less privileged in society. And the Enugu state government has announced the discharge of 2 COVID-19 patients 2 days after 2 other patients who were receiving treatment at the state's isolation center were also discharged. The 2 patients are cases number 5 and 9, a woman and her daughter, who were returning travelers from Lagos State. However, the state recorded 3 new positive cases, bringing the total number to 15 cases, with 9 active cases and 6 cases discharged. According to the State Commissioner for Health, Professor Ikechukwu Obi, the 3 new cases are said to have violated the interstate boundary order and entered Enugu State illegally. Now, Dr. Ibrahim Guazo, he's an epidemiologist from Texas A&M University. He joins us now from the United States. Thank you. Glad to have you on the program. First, tell us, how would you say the U.S. is responding to the pandemic while recording a large number of deaths?
Thank you for having me. So the U.S. has responded to the pandemic like a lot of other European countries or developed countries. The U.S. has significantly improved its testing capacity, cornerstone of responding to the pandemic. Initially, at the initial stage of the pandemic here in the U.S., the testing capacity was really low because of things like the CDC was trying to find a reliable testing method, and therefore the testing was not available in a lot of places, and people were having difficulties accessing them. But I think it's safe to see now that the U.S. has improved its testing capacity, and the response has also improved. The problem now that the U.S. is facing now is the issue of reopening the economy. The economy has been dormant for the last 6 weeks when the lockdown was affecting most part of the U.S. However, over the last week or so, a lot of states, or about 25 or 26 states in the U.S. have have eased their lockdown measures, and the economy is gradually coming back to the best possible expectations.
Just before I get your thoughts on perhaps how Nigeria is doing, U.S. President has threatened to withdraw and cut off funding for the World Health Organization. Do you think that it would adversely affect the capacity of the health body to fighting COVID-19 this period?
Well, absolutely. The WHO is the international organization that is responsible for coordinating the global response to pandemics such as this one. And certainly, funding is what is essentially important to this response. And the US is probably the country with the largest contribution in terms of funding to the WHO. So when the US decides to withdraw its funding, it is expected to adversely affect the response at the global stage. However, what we are seeing is an improvement in the funding from other countries in response to what the US had decided to do. And we are hoping this improvement in funding from other countries can bridge the gap and help the WHO to respond properly.
In Nigeria, we have tested almost 40,000, and we've been told that by experts we need to ramp up testing. But overall, how would you assess our last epidemiological report?
Well, as you said, as of yesterday, the May 18th, Nigeria was able to test at least about 35,000 or above 35,000, still less than 40,000, which is grossly inadequate. The cornerstone of responding to the pandemic is really is to do a lot of testing. Why do we need to do testing? Simply because we want to see who is infected and who is not. And once we know who is infected, we are able to isolate the ones who are infected to prevent them from infecting others. If you do not test, you do not know who is infected, and those who are infected would go ahead and spread the disease to the larger population. At the moment, Nigeria is not doing enough. If you look at the per capita testing that we have done in Nigeria, the 40,000 or the 35,000 is still less than 0.1 per thousand population. Compared to the other African countries like Ethiopia and South Africa, they have done much better in terms of testing. So there is still significant room for improvement in terms of testing in Nigeria.
We'd like to thank you, Dr. Ibrahim Gwaze, epidemiologist from Texas A&M University. Thank you for joining us on the program.
Thank you for having me.
And President Trump has criticized the World Health Organization for not doing enough. This is coming as the death toll from the disease has surpassed 300,000, with the number of cases going beyond 4.2 million.
U.S. President Donald Trump has sent a letter to the head of the World Health Organization, WHO, threatening to pull U.S. funding permanently over COVID-19. The letter outlines a 30-day deadline for the body to commit to substantive improvement or risk losing millions and U.S. membership altogether. Addressed to WHO Chief Tedros Ghebreyesus, it criticizes stages of the body's response since December. Meanwhile, the president made a surprise announcement saying he is taking hydroxychloroquine to ward off coronavirus, despite public health officials warning it may be unsafe.
No, I think for whatever it's worth, I take it. I would have told you that 3-4 days ago, but we never had a chance because you never asked me the question.
Did the White House doctor recommend that you take that? Is that why you're taking it?
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine. A lot of I don't take it because, hey, people said, oh, maybe he owns the company. No, I don't own the company. You know what? I want the people of this nation to feel good. I don't want them being sick. And there's a very good chance that this has an impact, especially early on.
Brazil's hospitals are nearing capacity as the Latin American nation becomes ground zero, as its cases surpass those of Italy and Spain. On Saturday, May the 16th, Brazil's health ministry registered 14,919 new confirmed cases in the prior 24 hours. With some 246,000 cases now reported as of Monday, it is now on track to surpass the United Kingdom. The global distinction is likely to pile pressure on President Jair Bolsonaro, who has been fiercely critical of the orders by many of Brazil's state governors for strict social isolation and quarantine to combat the spread of the virus, including the closure of schools, shops, and restaurants.
And CDC is saying take responsibility for your health. So is the World Health Organization. Well, our website, channelstv.com, has the latest news. All you need to do is log on, access the news at your fingertips. That's it on our COVID-19 update. Another update comes your way again at 6 p.m. I'm Minister Tumoka. Thanks for watching.